The infamous blood facial, or vampire facial, started making headlines in the 2010s. The facial is actually a form of platelet-rich plasma therapy, or PRP therapy, which is a form of regenerative medicine that uses injections of a patient's own blood to accelerate healing. This will vary depending on what the injury is, but the idea is that injecting platelet-rich plasma into damaged tissues will stimulate your body to grow new, healthy cells. Hematologists isolated platelet-rich plasma in the 1970s. It was initially used in transfusions to treat patients with thrombocytopenia, or low platelet count. Its ability to stimulate cell production and its anti-inflammatory properties quickly led to its use in a wide range of medical specialties and surgeries. In the last few decades, it has predominantly been used as a musculoskeletal treatment for tendon, muscle, and joint injuries, as well as arthritis-related pain. In more recent years, the injections have become more common for cosmetic procedures, such as treating male or female pattern baldness and alopecia, as well as tissue regeneration, wound healing, scar revision, and skin rejuvenation. Blood consists of red blood cells that carry oxygen and remove carbon dioxide from your body, white blood cells that fight infection and disease, platelets, which form blood clots and stop you bleeding, and plasma, a liquid that carries the blood cells, as well as water, proteins, mineral salts, sugars, fats, hormones, and vitamins around the body. Together, these four components make what is called whole blood. Whole blood contains around 200,000 platelets per milliliter, but platelet-rich plasma contains as many as 1 million platelets per milliliter. Platelets contain important proteins called growth factors. Without them, the body cannot heal itself, which means that without platelets, your body would be unable to control inflammation, heal tissues, or build new skin. The PRP therapy process is as follows. Step 1. Collect blood. Depending on the procedure, you will only need between 15 to 50 milliliters of blood drawn. The collection needle is inserted into a vein in the arm, and the blood captured in a small vial, much the same as it would be for a blood test. Step 2. Centrifuge. A centrifuge is a device that spins at high speeds. This action physically separates the red and white blood cells, platelets, and plasma. Step 3. Collect the platelet-rich plasma. The resulting 3 to 7 milliliters of platelet-rich plasma will be collected in a syringe to be administered immediately. Step 4. Injection. With the guidance of an ultrasound probe, the PRP will be guided into the proper location based on the nature of the injury being treated. Not all injuries will require the use of the ultrasound. PRP therapy for hair loss, for example, will simply make several shallow injections into the area that requires restoration. The blood facial uses the same collection and processing steps to obtain the platelet-rich plasma as treating a musculoskeletal issue. However, the method of distributing the PRP back into the body is a bit different. The blood facial actually uses a process called microneedling, which is the use of several tiny needles which prick the skin. This treatment can be done without the PRP, with the theory behind the treatment being that the small wounds cause trauma to your skin, which cause you to make more collagen and elastin. This is supposed to heal your skin and help fight the signs of aging. Platelet-rich plasma itself is a clear yellowish color. The reason you get such shocking images of blood facials is because the microneedling method they use to spread the PRP over a large surface area is causing the skin being treated to bleed. Numbing cream is applied to the treatment area beforehand, however it is still quite an uncomfortable process, with skin redness lasting up to a few days. Clinical studies into platelet-rich plasma therapy tend to be inconclusive. There have certainly been positive results demonstrated, but in general, testing the theory in a large-scale clinical trial has proven difficult. The most common sentiment in the medical profession regarding platelet-rich plasma therapy is simply that it should not be marketed as a miracle drug, but some may find benefits in its use.